Hi, I'm Dr. Nicholls and I'm going to talk to you a bit about fever in children, and this video will help you to know what's normal and what you can expect to happen if your child develops a fever or a temperature, and it also tells you when you should become concerned and seek advice from a health professional. So first of all, some useful facts. A fever is a raised body temperature of over 38 degrees. Mild feverish illness is a normal part of childhood, and it's a natural, harmless and healthy response to help the body fight infection. It's very common, affecting most preschool children every year, and common causes are things like viral infections, coughs, colds, sore throats and stomach bugs. Serious causes such as pneumonia and meningitis are very rare. So what can you expect if your child develops a fever? In most cases, fever gets better on its own as the child recovers, and infections generally don't require any antibiotics. It shouldn't really last more than about 5 days or so. So what can you do to help your child now and in the future? From about 4 weeks of age, you can use an electronic or chemical dot thermometer in the child's armpit, or an infrared thermometer in the ear canal. These are widely available from pharmacies and big supermarkets and are relatively cheap to buy. Now, avoid over or underdressing a child and keep your central heating at home on low. Tepid sponging isn't recommended, but it is okay to bathe the child in warm but not hot water. Offer your child very regular drinks, and if you're breastfeeding, offer the baby as many feeds as he or she will take. You can give paracetamol or ibuprofen if the child is unwell or distressed, but neither should be given routinely just to reduce temperature or to prevent the fits. Don't give them both at the same time unless you're advised to do so by a health professional. Instead, give the alternate drug if the child hasn't responded to the first one. So when should you seek medical help? Rarely, some serious conditions can cause fever in a child, and you should seek medical advice if your child has any of the following. So if the temperature is more than 38 degrees in a baby up to the age of 3 months, or more than 39 degrees in a baby 3 to 6 months. If the child is vomiting continuously or bringing up green vomit. If the child doesn't respond normally or wakes with difficulty, is much less active, doesn't really smile or cries in an abnormal way. If the child is breathing much faster than usual, this may look like the child's nostrils flare and the skin between the ribs or just under the rib cage moves abnormally during breaths, and also if you notice strange grunting. If the baby doesn't pass urine or has dry nappies for longer than 6 hours, and if the baby, in a baby, you may notice that the soft spot on the top of the head can either swell or be sunken. If the fever lasts more than 5 days, if you notice a new rash that doesn't fade on pressure, you can press a glass tumbler on the rash to see if it disappears. Other signs are if your child can't walk for some reason or has a new swelling in a limb or a joint. If the child has a stiff neck, cold limbs or has had a fit, then you should seek advice from a health professional. At Seymour Medical Practice, we offer a telephone triage service for on-the-day requests, and we do take children's illnesses seriously. We'll always try and deal urgently with any requests about a child, and it's useful for us to know why you're concerned about them so that we can deal with your call as efficiently as possible. If you do happen to be concerned about your child when the practice is shut, you should call 111 and they'll assess your problem and refer you to the most appropriate medical professional. We have further information on access to services on our other video called Accessing Healthcare. We hope you found these videos to be useful.